Hello, I am Dr. Manou Kaur, a consultant gynaecological surgeon. In this video, I will cover the basics of endometriosis, an often misunderstood condition affecting millions of women worldwide. If you or someone you know is navigating life with endometriosis, I hope to provide clarity, support, and essential information. Endometriosis is a chronic condition where cells similar to the lining of the uterus, known as the endometrium, begin to grow outside the uterus. It often involves the pelvic tissue. It can affect the fallopian tubes and the ovaries, where it can develop cysts called endometriomas. It can also affect other nearby organs, such as the bowel, the ureters, and the bladder. During menstrual cycle, this abnormal tissue responds to hormones, and due to its locations, it can lead to pain, particularly during menstrual periods. The surrounding tissues become irritated, inflamed, and can develop scarring that make organs bind together, which then can lead to pain outside the periods or to subfertility. In the UK, it is estimated that 1 in 10 women of reproductive age are affected by endometriosis. That's nearly 1.5 million women dealing with this condition daily. There are some possible theories about why endometrium-like tissue starts to grow outside the uterus, but the exact cause is still not clear. Our current research suggests that genetic, immunological, and inflammatory factors also play a significant role in the development of this disease. The symptoms of endometriosis can vary widely, but commonly include pelvic pain, abnormal menstrual cramps, pain during intercourse, lower back pain, and even pain with bowel movements or urination. Normal period cramps should be tolerable and not requiring time off from school, work, or social activities. Fatigue, constipation, bloating, and nausea can also occur, especially during periods. In some patients, it can cause fertility issues. Due to its diverse symptoms, endometriosis can sometimes be challenging to diagnose. On average, it takes about 8 years for women in the UK to receive a diagnosis, highlighting the need for greater awareness and timely medical consultation. Now, during your consultation, you will be asked to describe your symptoms and also the locations of your pain. So keeping a symptom diary can be helpful. You may need a pelvic exam, an ultrasound, or an MRI scan to get a better view of the pelvic structures. In some cases, a definitive diagnosis may require keyhole procedure, where a small camera is inserted into the abdomen through small incision with removing the abnormal appearing tissue of endometriosis, which then will be assessed in a lab under the microscope. Treatment for endometriosis is tailored to individual symptoms and needs. Options range from pain management with pain medication and/or hormonal therapies such as oral contraceptives, progestins, and GnRH analogs to surgery aimed at removing the endometriosis tissue. In particular, minimally invasive surgery such as robotic surgery is used for diagnosis and treatment. Emerging treatments such as new medications, pelvic floor physiotherapy, and lifestyle modifications including diet and exercise are also showing promise. While endometriosis is a chronic condition, many women find effective ways to manage their symptoms and lead fulfilling lives. If you suspect you have endometriosis, don't hesitate to seek medical advice and support. Early intervention and a comprehensive treatment plan can make a significant difference. And always remember, you are not alone, and there is always support available.